Hello, Calaveras County. You saw it at the beginning of the show. The doctor is in. That means Dr. Randy Smart is here. Dr. Smart, how are you?
Hi, Mike. Thanks for having me on the show today.
You bet. This time around, we're going to talk about something that's been near and dear to my heart for more than 40 years. But we're going to talk about a different type than what I have. We're going to talk about diabetes.
Diabetes, Mike. This is such an epidemic and really a public problem. I think you and I would be remiss if we didn't talk about this some, and so I'm excited about doing that and trying to get some information out to the public. And
I'll briefly, if you don't mind, get out of the way the type 1 part, because I have type 1 diabetes, and I was diagnosed at age 10. And that affects about what percentage of the people with diabetes? It's relatively low, isn't it?
So type 2 diabetes affects about 10% of the population.
Wow.
And type 1 is about 1%.
Okay.
Yeah, there's a tenfold difference.
Yeah. And when I was a child and was diagnosed, ironically, by Dr. Weichel here at Mark Twain Hospital way back when.
John Weichel,
yeah,
my friend.
Yeah, he was a great guy. And wonderful doctor then, but at that time, it was called juvenile onset diabetes, and what we call today type 2 was called adult onset, because generally, as it was explained to me, as people got older, their pancreases would kind of quit working or they couldn't keep up, and we had some drugs at the time, and now there's a plethora of them that help spur that on. But
that's correct.
I'm not going to steal your thunder, but
no,
we're going to do a little bit more on type 2 diabetes, which affects such a huge number of people in this country. And even to the point we were talking just before we started filming, some school children are coming down with type 2, which should be unheard of. And I'll let you tell folks kind of what type 2 is and what's going on.
Well, let's go back a little bit to the basics, because not everybody really knows what diabetes is. And so all the tissues in your body need a source of energy, a source of fuel, like gasoline. And that source of fuel is a sugar called glucose. So that glucose feeds your brain cells and your heart cells and muscle cells, and the glucose needs to be available, but sort of regulated. It generally has to fall within a high and a low limit. And that regulation is provided by a big gland in your belly called the pancreas. So your pancreas produces a hormone called insulin, and insulin then helps regulate the amount of glucose in your body. So the problem with diabetes is not that your glucose goes too low. That's not how it's diagnosed. The problem with diabetes is your glucose goes too high. And the reason for that is a problem with the pancreas and the insulin. So in type 1 diabetes, or the juvenile onset, there is an insulin deficiency. And we think that's an autoimmune disorder. So antibodies attack your pancreas doesn't produce insulin, and you're 13, 14 years old and you have diabetes. And you need insulin to survive. Well, type 2 diabetes is a different scenario. And in that scenario, the pancreas still produces insulin, but it's not very effective. So where the insulin is working on the muscles and the heart, and there's a problem where the glucose in the blood sugar doesn't get into those tissues. So the glucose goes higher and higher, and as that glucose goes over a certain number, that's what type 2 diabetes is. And that's where the problems start. So that's kind of the basics of what diabetes is.
And the problem now, worldwide, but especially here in America, is type 2. The numbers of people that have type 2 are increasing more quickly than ever before because we've gotten so heavy.
Oh my gosh. So let's look at Calaveras County.
Okay.
We have 45,000 people. So what we know is 10% of people have type 2 diabetes. So what, 4,500?
Sure.
And what's striking is about 25% of those, or 1 in 4, doesn't know it.
Don't know it. That's right.
So you have over 1,000, what is it, 1,100, 200 people in this county who have diabetes and don't know it.
And don't know it.
And you know, for the audience or the patient, they may say, well, if I don't know it, that's great, because I don't want to know it.
No.
Well, that's the problem, because if you don't know it, it's doing damage that you don't know about.
Yeah, it's
Right.
the prolonged high blood glucose values that ruin just about everything in your system.
Yeah, it's not a good thing.
Yeah.
And so we know that the diabetes has a much higher rate of cardiovascular complications, heart attacks, and they happen earlier in life, and they're more devastating, I guess. But there's a number of other complications, including complications with your eyes, where the retina in the back of the eye gets damaged and the blood vessels get damaged, and ultimately you can become blind. And there's complications with your kidneys, where your kidneys get damaged, and ultimately you can end up on dialysis.
Yeah, they can only filter for so long, and they can only work overtime for so long, and that's what type 2 does.
And they die.
It really
Right.
stresses them out.
So there's a number of complications, and you know, it's interesting. I'm trying to remember this number as we talk, but most type 2 diabetics are thought to have had diabetes 5 years or so prior to being diagnosed.
That's an interesting thing, because I've started hearing a lot more in the past 2 years about something they're calling pre-diabetes.
That's correct. Yeah, that's correct.
And how does that fit into this?
Well, our colleagues, the endocrinologists, keep drawing lines, and they're arbitrary, but they're based on a lot of really smart people with a lot of good knowledge, and so it used to be to be a diabetic. The definition was having blood sugar in your urine, because it went through your kidneys and it was in your urine. And then it became a blood sugar of, I think, over 140, and then it was over 130, and now a fasting blood sugar of over 126 is diabetes.
Wow.
But they're concerned because what about 125? You know, what is that? Or 124? And do you treat those patients differently? So rightly, they have created this category of pre-diabetes, where if your blood sugar is over 100 but less than 126, you're pre-diabetic. And in my mind, that's smart. And in my practice, I really try to identify those people, and I really try to intervene early, because I think diabetes is one of those diseases that's much easier to try to prevent and intervene early than to try to fix later.
Of course, especially type 2. And that's probably where we should go for viewers, is what should they be looking for in their day-to-day life? I mean, you mentioned someone maybe going as long as 5 years and not really realizing that they're a type 2 diabetic.
Right.
What might cue them in? What might they notice, little subtle changes their body is making that they might go,
So great question, absolutely great question. Early on, you don't know it.
You don't really notice.
You just early on, you just don't know it. Now, like pre-diabetes, like my pre-diabetic patients, they have absolutely no symptoms. They don't know it. You'd have to be tested.
Okay.
But let's say you don't get tested, and let's say it's been 5 years, and let's say now your blood sugar is 140. The symptoms are really sort of the symptoms of dehydration. Because what happens is your blood sugar, the higher blood sugar, starts acting as a diuretic.
Okay.
So the higher blood sugar then gets into the urine. When it gets into the urine, it takes water with it. So a diabetic, a patient who is becoming diabetic, the symptoms they would look for is they would urinate a lot more. They would be thirsty. And actually, they have weight loss. And this is where people get really confused. And they come in and say, hey, doc, great news. Over the last 3 months, I've lost 10 to 15 pounds.
Yeah.
And many of those times, that is diuretic water loss.
Okay.
I mean, they have virtually peed out 10 to 15 pounds of water, Mike.
My gosh.
Yeah. So the complications, like the heart attack or the eyes or the kidneys, isn't what they look for. What they're looking for are these symptoms of dehydration. But early on, there really isn't anything. But what patients need to know is there people that are at a higher risk. You know, like, who should be worried about this? Well, unfortunately, it's anybody that's overweight.
Overweight is number one.
So it's probably half of us right there. Anybody who has had problems with their blood sugar during pregnancy would be considered higher risk. And people with a family history, Mike. You know, if type 2 diabetes does have a genetic component, and so if you have that family history and you're overweight and or the pregnancy thing, then you're at risk, and you should probably be tested.
And what they're testing is the amount of glucose that's in your blood.
Correct.
Basically.
Yes, correct. They're basically testing your fasting glucose. Now, let me make a couple off-label comments.
Sure.
Off-label means this is my idea and isn't necessarily right. Right? So one is, if I was concerned I had diabetes and I was going to do the testing, I would make sure I had health insurance and life insurance.
Yep.
Because once you get that diagnosis, you're not going to get either one, either health or life insurance.
No.
And,
Nope.
And so that's not an official recommendation. But if you were to ask me, and you were thinking, you know, I'm peeing a little bit more, and I know I'm overweight, I think I need to get tested, I would say go get health and life insurance, and then let's test you.
Then come in.
We have time.
Yeah.
So that's one off-label comment.
Yeah.
My other off-label comment is many people know somebody who is diabetic. It's an epidemic, right?
Yeah.
There's lots of them. So if you know somebody who's diabetic, they have a device called a glucometer.
Glucose monitor, you
Right.
bet.
So you could go to your friend's house, or maybe your family, and you could test your own blood sugar and figure it out, or at least get some sense of whether you're diabetic without getting a lot of medical people involved.
Well, and he or she can also do that maybe 2 or 3 times over the course of a day, and you can realize, because that was my thing when my father was ill with heart-related issues. He was in the hospital, and I happened to walk in to visit him one day, and they've got all the stuff spread out, and they're, oh, your father's diabetic. And I said, based on what? Well, his blood sugar was high. How many times did you test it? Once. Well, that's not it.
No, that's not it.
When I was in the hospital, way back then.
You know a lot about this.
Way back then with Dr. Weichel, and I have joked with people that the biggest drag about being a diabetic who's in the hospital is you don't feel bad. You're just walking around feeling good, but you've got this thing going on. Well, every 2 hours, they're testing your blood. to see what your blood sugar does 2 hours after you eat a meal and 2 hours before you eat a meal, and they're watching how it bounces around. Now, of course, after I started taking the insulin, then we're watching to make sure I'm taking enough insulin or not too much and all that. And that's where the work is for me as a type 1 patient. But for type 2 patients, I have told people who've said, oh yeah, the doctor said I'm, starting to get highest. If you want, let me know and I'll, help you test your blood with you a couple, 3 times over the course of a day, and we'll look together and see what the numbers are, and you can say, yeah, okay, doc, we need to check this out because I think I'm running high.
It's pretty easy to do. It's pretty easy to do.
Yeah.
And what I would say is the most important measurement is what we call the fasting measurement. And so what that means is you have your evening meal, and I'm assuming that's going to be 6, 7, 8 o'clock at night. And then you really have nothing but maybe water after that. And the next morning, you test your blood sugar before you really have anything. And if that number is over 100 on 2 or 3 of those occasions, then you should probably go talk to the doctor. Well, you should get health insurance, life insurance,
Yeah.
and then you should go talk to the doctor. But if you were to look at standard medical advice, they would say, no, you need to go talk to the doctor the first time and have it tested correctly. It's a little bit of friendly advice. It seems to have worked over the years. But if the number's over 100, you've got some stuff you need to figure out.
Now, for me to do the off-the-market comment, one of my personal pet peeves about the diabetes universe is anytime it's talked about, everybody gets that dour look on their face and, oh, you're going to die soon. And that's not the case at all. It's a very manageable disease. It's difficult sometimes, type 1. Type 2, there's quite a bit out there that can help folks, and there's a lot of ways to manage it. And what are some of those? What happens now that we've decided, okay, you've got type 2 diabetes?
So we kind of, in terms of medical treatment, we kind of categorize those patients. You might think of it as mild, moderate, severe. And in the mild group, there's some very easy oral medications you use. In the moderate group, there's probably 2 of those. And as you get into the severe group, then we get into the injectable insulin.
Having to take insulin.
Yeah,
even with type 2. Huh?
Yes. Yeah.
Okay.
Exactly. But we've said this quite a bit, and it's probably more true here than any other time we've talked about this. Is lifestyle change is so important for this. And so there definitely is a correlation with weight and diet and diabetes, more than any other disease I know. And so if you're coming to see me, my job is to give you directions on diet and exercise. And that's not easy because these, people like you and me have been doing the same thing day after day for years and years. And suddenly you're gonna change the way I eat?
Yeah.
Wait a minute.
Yeah.
And, but it is just so fundamental, so much so that I refer the patients into nutritional education. And I have a certified diabetic educator really review the diet. And there's controversy about diet. There's a lot we don't understand about diet, and we've been through several iterations over the 30 years I've been an internist, and I'm still not sure we understand what the right diet is.
Wow.
Honestly, what I tell patients with type 2 diabetes is I think the best diet is the Mediterranean diet.
No? Okay.
And I don't know if that's right or wrong. I know I've talked to the endocrinologist down at UC Davis and some other places, and they've said, that may be right. But there's some very tough diets, like there's called the Dean Ornish diet. I think that's what it's called. But probably the Mediterranean diet is the best place to start is with the diabetic educator. But but whether they're available or not, or whether you're motivated or not, maybe a second option would be the Mediterranean diet. And that's basically vegetables, fruits, there's poultry and fish, pretty much no red meat. You can have eggs, and you can definitely have nuts and beans. Then, with a little bit of spice, you can
There's not a lot of carbohydrates in that diet, are there? Is there?
Well, there's not a lot of simple carbohydrates.
Yeah, because that's the big problem I can attest to.
Yeah, so just so the viewers know, a simple carbohydrate is sugar. Like a lifesaver or like a soda drink. It's just candy. It's sugar, and there's a lot of simple sugar, simple carbohydrates in food, and that is bad news. But complex carbohydrates are when all these sugars are kind of chemically put together, and the complex carbohydrates are probably okay in moderation. So it's a different kind of carbohydrate. But the bad news thing are these simple carbohydrates.
Yeah. Well, sadly, the majority of the American diet.
Man, everything. Everything.
It's.
I mean, I almost hate to say this on a television program, but the food industry is not honest.
No.
They're just not honest.
No.
And I'm not going to give you names, but there's a great book called The Omnivore's Dilemma. And it's written by a guy, I think his name is Matt Poulin, Poulan. He's out of UC Berkeley. The book's probably 10, 15 years old. But he really tells you about the integrity of the food manufacturers. And it's really worth reading. It doesn't have a lot to do with diabetes.
Yeah.
Kind of digressed a little bit.
But it's that, what's in the food?
What am I eating, right?
We've got this big, long list of ingredients, and the one I watch out for and always have, because initially, and that was something that I don't want to belabor us with, but initially I was told, don't do this, don't do that, don't do this, don't do that. Don't eat that, don't eat that.
No. Right,
so as a 10-year-old child, the first thing I did when I got to school lunch was, what can I trade to get a ho-ho or a ding-dong? Because they told me I can't have them, and I like them, so why can't I have them? And honestly, no one had, because in the medical profession, and we've talked about this too, we don't have the time to sit down with that 10-year-old patient and say, here's what's going on in your body, Mike.
It's kind of unfortunate.
It really is.
That we don't have that time.
And I got really fueled and full of information when I had taken some time and had been on the insulin pump for a while. And I got the Diabetes 101, what I would call a hardcore education. Here's what's going on in your body, and here's why you feel like that when your blood sugar goes sky high, and here's why you can't think when your blood sugar goes low. Because there's no fuel for the brain. Glucose, your brain is the only organ in the body that operates exclusively off of glucose.
Right.
So when there's no sugar in your system, glucose,
boom.
Yeah, and I've told people it's like being drunk, only you didn't have a drop to drink. It's a very strange thing, and until you learn what it's like to go into hypoglycemia, you have to be really aware.
You do.
For type 2 folks, do they have that same worry that the blood sugar goes low? I mean, obviously you can over-medicate, but I mean, are they walking as fine a line, I guess I'm asking, as maybe a type 1 patient is?
That is... what's hard about lumping diabetes together, Mike, is it's really this heterogeneous problem, and different patients are different, and not all type 2s are the same, not all type 1s are the same, and so in general, it's the type 1s that the hypoglycemia is a bigger issue.
Yeah.
The lower blood sugar, and it's an important issue, and the type 2s. Less so, but if a type 2 is aggressively managed and managed with insulin, you can definitely drop their blood sugar. You can definitely do it. And it's kind of the same thing. Do they understand the warning symptoms? Do they know what to do? Do they have a plan? But you can see it in both, absolutely.
We're getting down to our last few minutes, and so I want to kind of give viewers sort of the lollipop, if you will, and here's the idea, you know, don't panic about this. It's something to be conscious of and aware of, and if you're getting toward that edge where you may be pre-diabetic, it's time to ask your doctor. Well, it's time to get health insurance and life insurance and talk with the doctor. You're going to lose weight.
Should.
You're going to have to.
You should.
Yeah.
But you know, you're right. We tend to label people, and man, I really don't like labels. And so this diabetic label, I think, is kind of a bad thing. You know, like I'm a diabetic, therefore I'm a failure, therefore I'm going to die, therefore I have no self-worth. And man, we need to get away from that. I mean, it's a real disease. It's really not your fault, and it has real treatment, and there's absolutely no reason why you can't have a normal life once we get a little plan going and once you're on treatment. But we need to get away from this labeling thing where we label people and they become victims, and I mean, it's just not healthy. It's not good.
That always bothered me, and I'm going to call out a nationwide nonprofit, the Juvenile Diabetes Association. I don't want to see a commercial where a child is using a syringe as a crutch. I mean, that's
Really?
just a ridiculous mindset to
Yeah.
put forth. This child is suffering because he or she has diabetes.
That's really bad imagery.
That's terrible
Really bad.
imagery. And you know, this is coming from a person who's had the disease since age 10.
Right.
And at 54 now,
So
I've
how much
managed.
confidence is that child going to have?
Oh, zero,
Like
because
zero, right?
he's on a
Right.
crutch. He's going to
Right.
die.
I'm
He's on his
sick,
deathbed.
You know,
Yeah, you're never going to be
I'm
healthy.
never going to be normal. I can't have
Yeah.
a family. And that's nonsense.
No, it is.
Right.
Because you can be just as active as anybody else. You can, you know, do just about anything. There are probably a couple of professions that they wouldn't want a type 1 diabetic at in case of that low blood sugar. And I'll fully admit that I've had a couple times where I've slipped into it unawares. And it can be a really frightening thing if you're not around people who know what to do. But
you know, Mike, I've had type 1s that are soccer players, mountain climbers, marathon runners.
Yep, definitely.
I mean, done right, there is a lot that a lot of things you can have a normal life about.
It's like many diseases that us humans come down with. It's manageable.
It is manageable.
It takes some work, and you create a plan with your healthcare professionals, but it is something, it's not a death sentence. It doesn't mean you're, like you say, falling off the face of the earth.
Right.
You can go out and do just about anything. So
Right.
I guess our message for folks is pay attention.
What my message would be, 10% of you are diabetic.
That's a good point.
And many of you don't know that.
Don't know it. And so keep an eye out. And as usual, we'll just say it because we know we all need to. Lose some weight.
Lose some weight.
Lose some weight.
That helps
Get
everybody.
active. Get your system moving. And with that, Dr. Randall Smart, the doctor has been in, and now we're done for another episode.
Thanks so much, Mike.
Thank you, Dr. Smart. And until next time, ladies and gentlemen, I'm Mike Taylor. The doctor is out.